Your dentist has recommended a tooth extraction. Some reasons for an extraction include tooth decay, crowding, accidental damage, or to prepare your mouth for full mouth dentures. Here's what you can expect. Typically, when you have a tooth extracted, you'll receive an anesthetic to numb your mouth. During that time, be sure to take some extra precautions. You'll want to avoid food that requires chewing while your mouth is numb. And be careful that you do not bite the inside of your cheek, lip, or tongue. Numbness should go away after a few hours. If it doesn't, contact your dentist. Your dentist may place a gauze pack in the area where the tooth was pulled. This will help limit the bleeding while the clotting takes place. You should leave the gauze pack in your mouth for 30 to 45 minutes after you leave the dentist's office. Be careful to not chew on the gauze. If you experience some bleeding or oozing once you remove the gauze pack, fold a clean piece of gauze into a pad just thick enough to bite on. Dampen the pad with clean warm water and place it directly on the extraction site. Bite down firmly on the pad and try to maintain moderate pressure for about 30 minutes. If it becomes soaked with blood, replace with clean gauze as needed. After a tooth extraction, a blood clot forms in the tooth's empty tooth socket. This clot is an important part of the healing process, so avoid sucking on it or bothering it with your tongue. For the first 24 hours of the healing phase, you should take special care to avoid activities that might disturb the clot. Avoid smoking, rinsing your mouth vigorously, or drinking through a straw, since these activities create suction in the mouth. Also, avoid alcoholic beverages or mouthwash containing alcohol, and limit strenuous exercise. After a tooth extraction, it's normal to have minor pain and swelling. To help reduce it, try applying a cold compress to your face as directed by your dentist. Over the next day or two, your mouth should start to feel better. But if you experience severe or prolonged pain, swelling, bleeding, fever, nausea, or vomiting, call your dentist immediately. If you can't reach your dentist, go to the nearest hospital emergency room. For the rest of the day your tooth is extracted, brush and floss as normal, but avoid cleaning the teeth directly next to the healing socket until the next day. Be sure to brush your tongue. This will help get rid of the unpleasant taste that is common after an extraction. Gently rinse your mouth afterward with a warm saltwater solution of half a teaspoon of salt and 8 ounces of warm water. Remember, do not rinse your mouth too vigorously. After the extraction, drink lots of liquids and eat soft, nutritious foods. You can begin eating solid foods the next day or as soon as you can chew comfortably. And for the first few days, try to chew food on the other side of your mouth. Take care of your mouth after a tooth extraction. It'll help you avoid complications and heal as quickly as possible.